I'd like to welcome you to Doctor in the Making, where we will be discussing all topics related to medicine with the top influencers and doctors in the state of Florida.
When we get into the exam room, we're going to start usually taking a history. So I like to sit on the same level as my patient, as opposed to having the patient up on the exam table, half undressed, feeling uncomfortable. So allowing the patient to keep their clothes on and to sit on the same level already starts them feeling more comfortable. So we have our conversation. I may have my laptop right here while we're talking, so I don't turn my back on the patient while I'm documenting in the chart. One of the biggest complaints when electronic medical records started from patients was the doctor never faced me. The doctor was always typing with his back to me. It's important for us to keep eye contact with our patient. After we take the history, we ask open-ended questions and allow the patient to describe in their own words whatever it is they came in to see us for. So after we've taken that history, we move on to the exam. The first two parts of a physical exam should be done every time that we see a patient, commonly known as the vital signs. These are important numbers that we should know before we see the patient because some of the patient's condition could be reflected in alterations in their vital signs. The next very important part is the general description of the patient. The general condition that you see. Does the patient look chronically ill? Do they look like they've been sick for a very long time? Is the person in some kind of distress, which could be pain, it could be respiratory distress? And it's important that we know what position the person is in when we see them in or not in distress. Because some conditions, like back pain, could feel better in one position and worse in another. That's observation, and that's something that we can do on telehealth. It's really important that we take accurate measurements whenever we're measuring something in a patient. You want all your tools to be in working order, and you want your tools to match the job that they have to do. So most people have a thermometer at home, so even when we do telehealth, you can take your temperature and report it to the doctor. The blood pressure and pulse. So pulse, we're going to count. If we're doing telehealth, we'll ask the patient to count and we'll tell them how long a period to count for. When we do a blood pressure, or if a patient is doing a blood pressure at home, to follow up whether the medication is working or to find out whether they need medication, we want to be sure that they have the proper size of blood pressure cuff. You can imagine that a full-size adult and a newborn baby are not going to have the same size arm, and therefore an infant is going to use a much smaller cuff. So we've done a general exam, we've done vital signs, but we've already found out about their pulmonary status based on their breathing, and we found out a little about the cardiovascular status by their heart rate and by the blood pressure. Once you gather that information, we're going to put it all together and try and come up with a diagnosis. So this requires critical thinking. This requires the ability to take a long list of facts and details of the exam and try and come up with an explanation for how it all works, how it all fits together. What is the reason that the person is here seeing you if they're here for a sick visit?
Thanks for watching. If you like this video and you want to see more, click the like button below and follow me on Instagram at @DoctorInTheMaking_. Also, if there's a topic you'd like to see us talk about, make sure you let me know in the comment section below. And always remember, be grateful.